Welcome back to Business is Boundless in Kern County. I'm Richard Chapman, President and CEO of the Kern Economic Development Corporation, and with me today is Jason Wells, President of the Central California Network of Adventist Health. So the healthcare industry is critical for Kern County's economy. It's actually the second largest, almost 50,000 people are employed, and is the fastest growing projected over the next 10 years. So talk about Adventist Health's incredible footprint in California.
Yeah, we got this map here where you see the blue dots, and so those spheres are 8 hospitals. And so most of the towns that would not have hospital care if it wasn't for Adventist Health. So we have the only hospital in Delano, only hospital in Tehachapi, in Tulare, in Hanford, Selma, Reedley, and we now have 2 hospitals here in Bakersfield here in Kern County. But more importantly than just the hospitals is that clinic network, because we want to keep people out of the hospitals if we can keep people healthy. And so we have 130 clinics now that go north of Fresno, all the way over to Taft, all the way over to Mojave Desert, and that network of primary and specialty care clinics to really lean in and help people make healthy choices and get ahead of things before they need hospitalization is critical to the overall care of the entire Central California.
Well, and you totally hit on the themes that we talk about in terms of economic development, site selection factors, and access to quality health care is part of the slide deck that we deal with. So talk about your thoughts about how Adventist Health moves the needle in that arena.
You know, economic development, when we both serve on teams recruiting businesses in, and so they want to know they've got great schools, they want to know they've got great health care. Those two things are so essential for economic development, and so we feel too much has been given, as much as expected. And so when you think of a network where 33 communities in Central California get their health care largely from Adventist Health, and so many smaller towns, we are there to help bring that care to them. And so it is essential from an economic development standpoint. We pay almost $1 billion a year in salaries and wages to over 7,300 team members in the Central California network that our team oversees of Adventist Health. And so those dollars get reinvested in the communities. Our lowest paid position, entry level, is $23 an hour. And so it's exciting to see a livable wage, and it just goes from there as we continue to create growth for the
family wage jobs. And in the past, folks used to have to go over the mountain to LA for care. Now people come to Kern County for really amazing quality care. So in terms of your network, discuss the acquisition of the Bakersfield Heart Hospital as well as specialty care.
Yeah, so we did the first open heart surgery in Kern County. So Adventist Health has always been a leader in advanced specialty care. It used to be people felt like they needed to go over the hill. Back about 11 years ago, unfortunately, 50% of people were going over the grapevine for their cancer care.
Wow.
So we built the AIS Cancer Center 11 years ago, and it is the leading cancer center in all of Adventist Health, our entire footprint. And so over 70% of women choose to get their breast care with Adventist Health, the expertise, the amazing physicians that we have, and those partnerships. And so we have leaned in a significant way over the past couple decades in specialty care. So you think of advanced cancer care. The White House actually picked us of only two cancer centers in California to be a part of the moonshot to cure cancer by 2050 because of the expertise and excellence we have at the AIS Cancer Center right here in Kern County. And then from a cardiovascular, the Heart Hospital was a for-profit entity, and to bring that into a not-for-profit environment and keep 400 jobs from that place, not going bankrupt. Incredible care happening there, but the economic model, it just in a for-profit setting with shareholders, it just didn't work. We're a not-for-profit, and our mission fully aligns with Bakersfield Heart. And so it's been great to have that in the family. When we think of the over 1 million clinic visits a year, that specialty care was sometimes going up to San Francisco, that was sometimes going to Fresno, or even down to LA. Now it can come here to Kern County. And so with the Heart Hospital in the family, it gives us 4 more incredible cath labs, 3 more operating rooms, 47 hospital beds, and there is an influx of healthcare now to Kern County. Of this entire map, all of those communities, as opposed to leaving Central California, it's coming to Kern County for the specialty care.
Well, I know, Jason, you're a big advocate for culture, so tell us more about your thoughts behind that.
Yeah, so almost 30% of people in healthcare left during the pandemic. It was tough. And so we have really invested in culture in our team. And we have our turnover in the top 5% of the nation, meaning only 10% turnover. Most health systems are in 20, even pushing 30%. So we just took over the Fox Theater for a couple days, took thousands of team members through a celebration of them. And I think it's just a testament to the incredible nurses, physicians, the whole care team, housekeepers, and patient access. everyone loves their role, and the turnover, keeping people in Kern County, is amazing. So incredibly proud of the team and the very, very low turnover.
Thank you for all you do and your team for enhancing the quality of life in our community. And where can we go to find more information about Adventist Health?
You know, people can go to AdventistHealth.org and learn all about us, or just come by. You know, we have a brand new clinic over on Buena Vista, just down from Ming, across from St. John's. But want to encourage people to get primary care, to get plugged in, because that's the first step, making healthy decisions. The research shows when people have a physician, when people have a provider in their life, they live longer. And of course, Blue Zones is something we've been incredibly passionate about, you know, centenarians getting to a healthy 100. CRC, City of Bakersfield, incredible partners on the Blue Zones journey, helping Bakersfield and all of Kern County, you know, get to that healthy 100.
Really wonderful to partner with you, and thank you for joining us today, Jason.
It's been great to be here.
Thank you. And remember, business is truly boundless in Kern County.